I'd like to congratulate you on making this life-changing decision on proceeding with a total ankle replacement. I'm Dr. Pete Deol, a board-certified orthopedic surgeon who specializes in foot and ankle surgery. This short video is designed to familiarize you with an ankle replacement, including the procedure, advantages and risks, some of the complications, and what a typical recovery looks like. Along this journey, we'll be accompanied by my clinical assistant and my advanced practice providers, who are all here to help answer any questions and help you feel comfortable along the way. We often get asked, what is an ankle replacement? I tell patients an ankle replacement is similar to a hip and a knee replacement, where you're creating an open joint surface where there's a metal component on one surface as well as a metal component on the other surface, and a piece of high-grade plastic in between to create a near frictionless surface. Many people describe joint replacement surgery as a resurfacing, where we just take a small layer of bone on either side of the joint to remove the arthritic surface. This includes removing any bone spurs, scar tissues, or any mechanical blocks that may impede the motion of the ankle. So when the ankle replacement is completed, you should have a smooth, open joint surface to allow for motion to occur. It's important to know what to expect from an ankle replacement. Total ankle replacements have a high rate of success, similar to what we see with total hip and total knee replacements. In most cases, patients are able to return to a higher level of activity than what they experienced before their surgery. We expect patients to return back to hiking and golf and tennis and other recreational activities. To prolong the life of the joint, we do ask patients to abstain from impact activities such as running and jumping. Most patients will expect to see about 80 to 90% improvement in their symptoms. This includes pain, swelling, and stiffness. There are some common symptoms patients can experience after surgery. Swelling is common to see after surgery and can oftentimes linger for several months, but typically will improve over time. Stiffness is also a common feature to find after ankle replacement and is typically an indication of how stiff the ankle was before your surgery. We do expect to see improvements with motion, but it's hard to return to a full range of motion similar to what you may have had years ago. A patch of numbness is also common to experience in the front of the ankle. This occurs from the smaller nerves that are unable to be seen during your surgical exposure, and typically that patch of numbness will regress and get smaller as time goes on. It's common to experience clicking and clunking of the joint during your recovery. These are mechanical parts which can move, and it's typically not concerning when we see this. It's important to know about the risks with ankle replacement surgery. These can include infection, blood clots, wound breakdown, the potential need for an additional surgery if the implants loosen, and potential dissatisfaction with pain relief. Although these are generally rare and occur less than 5% of the time, most patients don't experience these. Your surgery will likely take anywhere from 2 to 3 hours. That's dependent upon the complexity of the surgery and any additional procedures that may need to be done. Will oftentimes include ligament repairs or tendon lengthening procedures in addition to realignment procedures that need to be used to balance out the ankle. Our anesthesia plan is focused on making you comfortable both during surgery as well as afterwards. We use a combination of a lighter general anesthesia with a regional nerve catheter. That regional nerve catheter allows us to provide pain control for the first several days after your surgery, allowing you to go home and have a smoother transition to oral medication. So now it's time for your recovery. With many of the advancements we've implemented in our postoperative protocol, most of our patients can return home the same day of their surgery. This allows them to recover in the comfort of their home, surrounded by their loved ones. Any of our patients with pre-existing medical conditions may benefit from an overnight stay at the hospital, in which case we're often able to send them home the following day. Patients are not allowed to weight bear for the first 2 weeks after their surgery. At the 2-week mark, we then do transition patients to a boot to allow them to stand and weight bear on the ankle. That coincides with the beginning of physical therapy. At the 4-week mark, we allow unrestricted weight bearing within a boot, which continues for 2 additional weeks. And then at the 6-week mark, we start to transition back to a shoe. Most patients are able to return back to their daily activities by 3 months, with return back to exercise and sports following that. By 6 months, most patients are back to their normal activities, with stamina and strength continuing to improve throughout the year. Thank you for taking the time to watch this video. and for the opportunity for me and my care team to take care of you and your loved ones. You'll receive a link to the video, which you can watch again, and feel free to share that with your family and friends. Should you have any additional questions, please feel free to ask.